I'm Dr. Amy Swegan, and I am a wound care physician with Primus Wound Care. I was in private practice general surgery, did hernias, gallbladders, colonoscopies, EGDs, all the little lumps and bumps, that kind of thing. I really loved general surgery, and I didn't want to give it up, but you could see where things were headed. More and more call, patients were more and more demanding, administrators were more and more demanding. I was having trouble continuing to make the same amount of money that I had made in previous years. Even at 7, 8 years, I was still like the new person who had trouble building the practice that I wanted to build. The average general surgeon gets sued like twice in their career. And I was at that point where I had been doing it long enough that I was due. There's much less risk in wound care. That was kind of the tipping point. I work 4 days a week. I guess I would consider that full-time. It's significantly less than when I was in general surgery practice, so it doesn't always feel full-time. I have 3 school-age children, and I wanted to find something that I could be home at night, not work every third weekend, not take call every third night. They noticed more and more, my kids did, that I wasn't home. I work Monday, Tuesday, Wednesday, Thursday, with Friday off. I don't have to leave every Saturday morning and go make rounds at the hospital ever. I used to have to do that every Saturday. I worked every Saturday. I usually get up and leave the house 7:15 or so. I usually get to my first facility between 7:45 and maybe 8. I'll round on 10 or 12 patients, somewhere in that range, and then drive to the next facility, round on maybe another 10 or 15, sometimes as many as 20 patients. Sometimes that's the whole day. Well, I took a long time thinking about it. I was very much afraid if I left general surgery that I would miss operating. I do. Not enough to go back, but I do miss it. There's always be that one patient, you'd be like, I'm done. And then you would have one great case where the people were nice, or you had made a great diagnosis and the surgery went well and everything went fantastic, and you go, no, this is why I'm still here. This is why I'm still here. Those became fewer and fewer. You were his resident almost, for lack of a better term. You rounded with him, and you start with the basic of he shows you what he's doing, and you almost shadow him and don't do anything for a while. And then as you learn the EMR system, you start doing some of the documentation, and then you do some of the things that you see most often, the most common pressure wounds and that kind of thing, and you build up from there. It took probably total about 2 weeks or so. But then when I was doing some on my own, I could still call him or send him a picture or a text or a phone call, that kind of thing. He'll leave you alone most of the time, helpful when you need it. You can call him anytime about anything.